The people who have money, they can buy their health insurance, but for the common mortal, it's not that easy because you wait a lot of time.
My mother is waiting for a medic about 2 months to have
Okay,
to go to a medic.
Okay.
Yeah.
But you always choose the you know where to go, right?
Okay.
Yeah. So it's always better to go with the private one. Yeah.
If you see the news, for example, every day in the news it says that they close down emergency rooms, and yeah, it's just a real disaster, but it's free, so yeah.
Si je vous dis chaleur, poisson, océan et pastel de nata, vous pensez qu'on est où? On est juste à côté du pont là, Lisbonne, Portugal. On va aller voir les passants dans la rue, leur demander ce qu'ils pensent du système de santé actuel ici. Et c'est parti, let's go. George, what do you think about the healthcare system in Portugal? You have to pay insurance, stuff like that?
Well, I have insurance to go to the private hospitals, and why? Because if I need a medic, I normally have to wait in long lines to have a medic. Example, in my public clinic in my zone, it's very stressful because if I get sick, I go to the medic, and sometimes I have to wait 5, 6, 7 hours to have a medic. And if I don't go to work because I'm sick, I need to go to the public clinic to ask for a paper to justify my fault, and I needed to wait 5, 6, 7, 8 hours to have that paper. But now Portugal started to believe in the private clinics to give to us that paper to justify in the work.
Okay.
And yeah, a lot of people don't have a public medic. We have a very low percentage of medics, and that is a big problem. My mother is waiting for a medic about 2 months to have
Okay, 2 months,
to go to
yeah.
a medic.
Okay.
Yeah. But this
Normal medic or just clinic?
is a normal
Okay.
medic to a clinic. So that's why we go to the private
Okay.
ones.
And you pay when you go to the private?
Yes, I pay.
How many, for example? For a year?
I have insurance, so my insurance in private, it depends of the medic, but I pay €5. But a normal person with insurance pay
How many?
In my case, €5. But many people pay €30 if they have insurance. If you not, €90, 100. It depends.
Okay.
Well, it's not all bad, because if you need a medic, you go go to the urgencies. You don't pay, our country pay. If you are a French and you need to go to the public system, it's good, because in the United States we know that if you go to urgencies, we have a big bill to pay. Here, you not. That's a good, but we have we have low medics, you see, a low level of medics.
There is good medic, but
I think it's
low
one
medic.
one medic per.
Donc Mathis, tu peux me dire d'où tu viens?
Donc je viens de France, de Clermont-Ferrand précisément, à côté de Lyon. Mais on vit ici avec ma copine à Lisbonne pour 1 an pour l'instant.
D'accord. Donc dans le cadre d'études ou
Oh non, on a fait une année de pause, entre guillemets, de césure pour vivre un peu la vie de Lisbonne.
avec le soleil?
Ah, c'est ça exactement.
Donc on voulait savoir un peu comment ça fonctionne ici le système de santé, et quelle étape il y a eu pour arriver un peu à synchroniser tout ça. Parce que du coup vous êtes plus en France, c'est ça?
Exactement. Donc après, grâce heureusement à l'Europe, on bénéficie de la carte européenne, la CPEM, il me semble. Et donc grâce à ça, on a quand même une sécurité au niveau de la santé. Alors moi, je sais que je suis tombé malade il y a quelques années au Portugal aussi. Et grâce à cette carte, j'ai pu aller dans un hôpital facilement, ressortir sans frais, sans avance bancaire. Et donc ressentir comme si on était en France, à l'hôpital en France. Pour l'instant, on n'a pas eu de mauvaise expérience avec ça.
Principal.
ici. Exactement. Mais bon, on reste en Europe, donc on se sent privilégié, en tout cas par rapport à ça. Et de par nos boulots respectifs, on a des assurances santé qui sont payées par l'employeur pour nous garantir en plus une assurance santé pour de graves accidents par rapport au boulot, etc., au travail.
D'accord. Donc une sorte de base pour se protéger, et puis des suppléments, mais qui sont même pas payés par vous.
C'est ça, exactement, payé par l'employeur, ou surtout pour le cas du travail, si jamais on a un accident du travail, pour être remboursé à ce niveau-là.
Ok.
Et voilà.
Marta, you live here?
Yeah.
Okay. And you are from?
Poland.
Poland. Can you explain us how work the system in Poland?
In Poland, sure. We have something called NFZ. God forbidden to go with that. because that's crazy. Very crowded hospitals, and basically I would say healthcare is not the best because and I send the full support, I swear. Teachers and doctors, they should earn money, you know, like you give money to those people because they really need to earn money. So that's the problem. They don't earn enough money, they don't care too much.
Okay.
Although if you go for a private insurance, with the cost is really not that bad, you have a very good care.
Yeah, you'd go to the clinic, for example.
Oh yeah, you have a very good care, like absolutely the top of the top care, as I can say. Yeah,
Okay.
yeah.
But you have a free access to the hospital too.
There's a thing. No, you have the private the private places where you can go. You have the access to hospital. Yeah, obviously. Like this is one-to-one. Yeah, but you always choose the. You know where to go, right?
Okay.
Yeah. So it's always better to go with the private one. Yeah.
Okay, and if you have an experience like your friend about an injury that you had.
So I am the lucky one. I didn't, never. I only heard from my friends, or I was also experiencing this with them.
Yeah.
So that's exactly what I can say. If you are sick and you go to private hospital, you are treated amazing, and everything is nice. Really, the healthcare is good. Also, I would say an environment with which you are staying, including like everything what is around, because I think it matters as well. You know. It's just so much better, and at the same time I got a friend who had very bad problem with, I don't know how to say when this broke. You are full with people, sometimes you stay in the corridor, what the fuck.
Yeah.
I mean, bro, I swear, like people are running there
You are
with
very sick and
people with
you
beds,
rest.
yeah, and you are literally lying down in the corridor looking at all that, you know, it's
Okay.
it's this kind of vibes. But private, go with private is okay.
In France, it's very hard to be doctor or physio
funny.
or dentist, and they go to Portugal for study.
Oh.
What do you think about that?
Well, I didn't know that. Actually, I didn't know because my idea, and I know some people that needed to go. I have friends that needed.
It's not
to go
all the
to-
French, huh?
Yeah.
French people. It's not about all the French people. It's just
Yeah.
about some category of the population.
Okay.
Go to the exam, and
Mhm.
it's hard for people to
Yeah.
have a physio, dentist, medical.
Okay, here dentist you can be on private. You can take
Yeah.
the degree in private. But
Do you know approximately the price of the medical school or a
well,
dentist school?
No, I don't. I
No?
don't. I
For a
took
year?
attorney. It was attorney course to be in law. You see. I was in private and I paid per month 300 euros. So for medic, you can't be a medic on private. Medic you can't yet, but dentist you can. But I don't know the price in privates.
Okay.
In
okay.
private schools, universities, I don't know.
Okay.
But yeah, we have a lot of problems to and another problem. A lot of medics, when they go outside of university, they need to serve in public system for 5 years, and after that 5 years they'll go out.
Yeah.
And that's why, because in Portugal they pay very low.
It's actually the same in France.
Yeah.
About the physio, you have to wait 2 years in
Okay.
in difficult space or at the hospital, and after you can go out. But they don't go out the country. They go out.
Yeah, here, example, we have a CUF, private clinics, hospitals, and they pay very well and better. So the medics, if you are pay low, you work a lot of hours, you see. Some medics and nurses, they work 16 hours, a lot of hours per day. And I know that the nurses receive in median 1600, 1,060 euros.
Okay.
You see, a lot more, but they work a lot of hours and
It's
they
the
are
same in
full
France.
public, so they go to where? To the private ones.
Yeah.
And many
For
go
more money
outside.
and good condition.
Our government, they want heroes. You see, like you see in movies, heroes sacrifice for the country, but they are living good lives with a lot of money, corruption, etc. And our heroes, a lot of hours of work, a low salary, so they go to the private ones or outside after that 5 euros. So that's a lot of problem. That's why many people don't want to work for the public system, and that's why we have a long lines to wait for the medic, because low low medics on the public system.
What do you think about the healthcare system in Portugal?
I think the system is really poor because the people who have money they can buy their health insurance, but for the common mortal is not that easy because you wait a lot of time for vacancy, and yeah, I think that's it.
And you have an experience like that?
Have what experience?
An experience about waiting? Yeah.
Yeah, I have one. Like when I broke my head one time, and I waited for like 8 hours
Okay.
to be saved.
Okay. And so you pay some insurance? You?
Yeah,
Okay.
I
How
do.
many you pay by year?
20 euros a month.
It's obligated to pay?
No.
Okay. You don't have to pay. You can go to the public
Yeah,
hospital.
you
if
can
want.
go to the public hospital, but I think it's better for you to have something that keeps you
Okay.
safe. I don't know.
So Pablo, can you explain us how work your healthcare system in Lisbon?
Yeah, of course. Everything is free, first of all, so you don't have to pay for any type of medical insurance. It's can I swear? I can't, right? It's really bad. I'm not going to swear because I don't want to ruin your work, but it's really bad because we have a shortage of doctors and healthcare professionals.
Okay.
Because we don't pay well, so everybody just leaves the country. So I don't think if you see the news, for example, every day in the news it says that they close down emergency rooms, and yeah, it's just a real disaster. But it's free, so yeah, I've had a couple experiences with them. I'm not gonna lie, the hospitals are really crowded, and it takes a long time to be like seen by a doctor.
Okay.
But once you're seen by a doctor, it's very good. I have no complaints. I've been very well treated and very well taken care of.
Okay.
So yeah, overall I would give it from 0 to 10, maybe a 5, because it's not the best, not the worst. I've been in the Netherlands also, and the medical care system there is better, although you have to have insurance, but it's also just way better.
So there is good doctor, good physio here.
Yeah.
You said.
No, there is a very good doctors over here. I cannot complain about the Portuguese medics and
Just the time you wait about.
Yeah. Just the time.
You just talk about the time you wait for an appointment, for example.
Yeah, that's the only complaint I have to do. And of course, they're shutting down hospitals, shutting down emergency rooms. But when it comes to being taken care of and actually seeing a doctor and talking to one, it's very good. We have very good medical professionals over here.
Joanna, what do you think about the healthcare system in Portugal?
I think it's good in general, but it has some big problems, mostly in big cities as Lisbon, because there are too many people, not too many doctors. So the health system tries, but not always can go the way you want to.
Okay. And you tell us about your experience.
Yeah.
Yeah.
I came from a very small hometown in the north of Portugal, and there the health system works very well. You have enough doctors, you have good conditions in general. But then I came to Lisbon about 10 years ago, and for example, when I was in a very bad motorbike accident, I had to be operated, and I had to go to private. Otherwise, I would to wait 1 year to get operated in my knee. So if you need anything with some urgency, you have to go to private. Otherwise, the public can't deliver what you need in the right time frame.
And do you pay for example, for an insurance about the
I pay
private?
for an insurance.
And
yeah.
what is the price, for example, to know for 1 year in the private?
Yeah, it really depends. But if you go to the basic one, let's say, it's 30 euros per month.
Okay.
The most basic one. And if you want an extra of anything, it starts on 50 per month, and it can go up to 2,000.
So it can go very up.
Yeah. If you really want teeth insurance, and you want if you got cancer and so on, those are add-ons. So if you want the basic one, you can get one for 30 euros per month. But if you want extra advanced, you have to pay a lot.
And for now, you pay how many? You pay?
Now I pay 50 per month, and I have the basic with some plus things.
You have stuff like dentist.
No, I don't have dentist.
You have to pay if you are.
Yes.
On demandait à Philippe qu'est-ce qu'il pense du système de santé au Portugal. Donc on est à Lisbonne ici. Est-ce que vous habitez ici?
Oui, ici.
Ouais. Donc vous êtes né ici
Non ici, mais
Ok.
à Rende.
Ok. Et donc, qu'est-ce que vous pensez du système de santé au Portugal? Est-ce que vous trouvez ça simple d'accès?
C'est un bon système, mais nous avons besoin de beaucoup de médecins, enfermeiros,
Les infirmières, oui.
infirmières, et de beaucoup de choses.
Ok.
C'est difficile.
Nous, ce qu'on veut savoir, c'est comment est-ce que c'est difficile pour vous d'accéder aux médecins, par exemple?
Très difficile.
Très difficile.
Regarde. Un arrière, j'ai besoin d'un médecin pour une situation spéciale. Et j'ai nécessité de 3 mois pour accès au médecin.
C'était un spécialiste ou un médecin généraliste?
Pour avoir accès à un spécialiste.
D'accord.
Ouais.
Ok. Est-ce que vous voulez nous raconter votre histoire, par exemple?
C'est difficile.
D'accord.
Non, c'est difficile pour deux raisons. La personne en cause, ma femme.
Peut-être que vous voulez pas trop en parler.
Et il n'a pas de relation avec le système.
D'accord. Oui, c'est des relations personnelles. Est-ce que vous allez gratuitement chez le médecin ou à l'hôpital?
Gratuitement.
Donc vous avez un système qui est gratuit.
Gratuit.
Ça, c'est important à souligner que le système il est aussi gratuit ici. Vous avez des assurances à payer ou
Je ne comprends pas.
insurance?
Dans notre travail, nous faisons une participation tout le mois pour l'assurance sociale.
D'accord.
Et après, pratiquement tout c'est gratuit. Pratiquement tout.
D'accord.
Ouais.
Et
Par exemple, ma femme a fait un examen
un examen, oui.
qu'il a payé 400 francs
D'accord.
pour accélérer le process.
Ah, pour aller plus vite.
Les plus vite.
D'accord. Donc c'est juste une histoire d'hôpital et d'accélération du processus, quoi. Donc si on veut que le processus médical aille plus vite, on doit payer.
Oui.
D'accord. And can you tell us if you had a bad injury and how you
Yes,
you have been cared?
I have rhabdomyolysis.
Okay.
I don't know if you know what that is.
Yeah.
It's a kidney disease, and
It's about the muscle.
it's about the muscles, yeah, but it affects the kidneys. And I only have one of my kidneys working. I had to do 12 sessions of dialysis. And when I got into the hospital, I was very well taken care of. Everybody, they have a special doctor there for me, and after that, I was very well taken care of. Still had to have some precautions, and I had to go to the doctor a couple times after, but everything was taken care of properly, and everything's fine.
Did you had an experience with the sport injury, for example?
Sport injuries?
Yeah.
Yeah, the one I told you, for example,
Okay.
was like a fin. A fin just crossed my head.
Okay. And how you do that?
Surfing.
Surfing. You do surfing in Portugal?
Yeah, sure.
That's cool. You go to the physio for that?
Not for that one, but I work in a kitchen too, and I cut myself. I had an injury in my hand,
Yeah.
and I did like for 10 months physiotherapy.
10 months physio?
Yeah.
Okay, it was cool. The physio, it was cool with you?
Yeah, it was.
Est-ce que vous avez une expérience, par exemple, à nous partager par rapport à une blessure que vous avez eue, même en France?
Les ligaments croisés, j'ai fait le choix d'intervenir dans une clinique privée, donc avec des honoraires assez importants quand même, mais pour un choix d'une certaine qualité parce que c'était quand même pour une vie. Les ligaments croisés, si on les fait mal, c'est un peu plus compliqué sur l'instant. Et puis après, j'ai eu la chance de bénéficier du coup d'un kiné, d'un ostéopathe, etc., d'un accompagnement après gratuit, mais uniquement la chirurgie en privé. Voilà, mais tout s'est extrêmement bien passé. Je suis très heureux de vivre en France pour ça. Voilà.
Pour l'instant, même si vous n'êtes pas en France, vous avez toujours l'uniformisation un peu des soins, donc ça change absolument rien, c'est ça?
Oui, pour l'instant, en tout cas, après on peut parler de la qualité des soins qui est peut-être différente, mais en tout cas de la prise en charge générale, c'est pareil.
You had an injury about, for example, in football. You play football?
My knees, they go outside sometimes,
Okay.
but I go to the
You have luxation.
when I play football, so I stop to play.
You stopped to play.
Yeah, and I always went to the private. I had that luck, and I worked for that. But when I go to private, It's only a few times I went to the public system, but I believe on the medics there because they are very good medics who work on the public system. The public system in Portugal has a lot of good medics and nurses. They work so hard and they are very professional.
C'est important.
And our system is one of the best, but not because of the system the politics made, but because our professionals. You see the dedication of them. It's awesome. I like a lot of them, but it's sad because our politics that.
It's really important to notice that. It's the effort that they do all the day, all the night. Bon, les amis, merci d'avoir suivi la vidéo, c'était super intéressant. N'oubliez pas de liker, de partager la vidéo à vos proches et à tous vos contacts. Dans les commentaires, ce qui est important, c'est que vous me disiez où est-ce que vous voulez qu'on aille pour la prochaine vidéo. Ça peut être une région ou un autre pays, ça peut être l'Europe ou ailleurs. L'objectif, c'est d'avoir vos avis, vos suggestions pour le futur. Et puis, à bientôt pour une nouvelle vidéo. Ciao!